Hi, my name is David Chan. We're here at the RSNA showing the Carestream OnSight 3D imager, extremity imager. The unit was designed specifically for the orthopedic and the emergency market. As you can see, the unit is a cone beam CT scanner. Cone beam CT differs from traditional CT in how the images are captured. Okay, the unit, as you can see, can image anything from your hands, wrists, elbows, to your knees, your ankle, and your feet. The nice part about being able to image your lower extremities is you can actually do it weight bearing, and that provides advantages looking at the joint as with pressure, how it, if there's any lateral displacement, medial displacement, you can see if there's any narrowing in the joint space, looking at possibility of disease. As you can see, there is a door which allows patients to easily access the system. For positioning a standing knee, it's just a matter of the patient walking in. Technologists would close the door, bring your arm support down. Now you can see how a standing knee is done. Fairly easy workflow. Depending on the radiologist or the orthopedic protocol, you can have a block here to apply either partial weight or full weight on the one knee or equal weight distribution. Something you can't do today in traditional CT systems. It's just a matter of now opening the door for the patient to exit the system. Now the standing knee is completed. The unit itself has 3 axes of motion. You have joysticks on either side that controls this motion. There's up and down. There's also rotation. And we've added a third angle, which is tilt, okay? Now having the 3 angles allows patients to access the unit either from the front or the side. So allowing flexibility on how you sight this product. If we come over here to the unit itself, as you can see, the work list is similar to what you would have in our traditional products. It's a matter of just selecting the patient from the patient work list, and all this is going to be driven by your wrists. Your wrist codes would tell the system what body part you're imaging and what position you're having the system in. It's just a matter of selecting the patient. Now, the automatic system will automatically auto-position to the appropriate exam that you're doing. So for this particular example, we're doing a standing knee, okay? As it's getting into position, the system will automatically let you know when it's in position and ready for the patient. As I said earlier, having the 3 axes of motion allows the patient to enter from the front or the side, so offering positioning flexibility and layout flexibility. Once the unit is in place, now it's just a matter of moving your patient chair up to the system. There is a center line on the bore, and there's also a fiducial line on the chair. What this does is it allows you to align the femur if you're doing a sitting knee, have the patient sit on the line. Now it's just a matter of swinging the patient into the system, closing your door. Now I have my sitting knee, okay? After the patient is scanned, now it's just a matter of opening the door and now swinging the patient out. Now you've just completed a sitting knee. The unit itself will also give you the capability of acquiring scout images, looking at your total field of view. So it's just a matter of hitting the prep and exposure button, and it will automatically capture your scout images. Here it shows you the full field of view of what you're actually capturing. If you wanted to do another scout at 90 degrees, it's just a matter of selecting the second scout. If you want to go directly to the cone beam CT scan, now it's just a matter of selecting the scan and hitting the prep and expose button. And as you can see the video, or as you can see, the projections are shown here on the volume that you're actually capturing. After the volume is captured, it will automatically reconstruct the preview volume for the technologist to determine if there's any patient motion. While it's doing that in the background, it is also reconstructing the full volume for you. When the full volume is available, you'll see this 3D image here. You can magnify that, and you're going to be able to pan and swivel this 3D image as you would on a traditional workstation. In the event that the orthopedic surgeon would like you to change your cut angle or reconstruct the body part through the joint, the technologist has the capability of adjusting your cut angle to be able to reconstruct. After you've reconstructed and you're happy with the images, it's just a matter of accepting the image and it's all delivered to the PACS. Now that we've acquired the images, once it's sent to the PACS, as far as the user goes, now you can see the images that you've captured. On the image on the left, you can see that there is metal in the patient, and what happens when there's metal in orthopedic imaging, particularly with CT, is you get a lot of spray artifacts, which renders the image almost undiagnostic, okay? So what we've done is we've applied a scatter and metal correction algorithm to the same study on the right. You can see the difference between the two images, particularly with the metal. So the image on the left, you can see with all the metal spray artifact, it degrades the image and you're not able to see what's happening inside the metal. In this particular example, the screw is broken, but you have no idea what's happening in here, whether there's different fragments. But on the image on the right, you can see clearly that it is broken in two pieces. As we kind of scroll through this, you can see the advantages of having a metal corrected image. On top of that, not only are we correcting for the metal, but we're maintaining the image quality, therefore seeing the trabeculation nicely in this particular example. In this next example here, the patient has a tibia fracture. As you can see, if there is metal in the patient, it's going to start degrading the image. But as you can see here, even though there is metal, I'm able to see the fracture plane. As I zoom that up, you can see that even though there is the metal rod, if I zoom up a little bit more for you, you can see there's trabeculation bridging showing signs of healing. Now, orthopedic surgeons, it's always been a challenge for them to see exactly what's happening inside the fracture plane, particularly with volumetric imaging. With the metal degrading the image, you can see here, we've applied that scatter and metal corrector. You can see exactly what's happening inside the fracture plane, giving the orthopedic surgeon more confident diagnosis. Here's another image showing you the quality of the bone imaging that you can get from the system. As you can see, as I scroll through this, you're seeing the fine trabeculation in the calcaneus, and where this is important is if there's any type of small fractured bones in the wrist, you can now, with a volumetric image, be able to manipulate the image to be able to see the whole structure of the bone, whether there are any type of occult fractures or any fine subtleties in the bone. So this is the Carestream OnSight 3D extremity imager that we are showing at the RSNA. As I said, it is investigational, not available for sale. We hope to file for 510(k) early in 2016.